My name is Kelly Gillis, and I'm the Senior Director Planning, Integration, and Community Engagement with the Southwest LHIN. Today we're going to be talking about Partnerships for Health. Partnerships for Health is a program that we have here in the Southwest LHIN. It's a 3-year project, in fact, where we're working with providers that support individuals with diabetes care to look at how they coordinate care across the various sectors to ensure that patients receive the best possible care in their communities. The Southwest LHIN identified chronic disease prevention and management as a key priority in our first integrated health service plan, and we've continued to see it as a priority in our next IHSP. Early on, we were presented with an opportunity to look at a model that would result in strengthened partnerships across our LHIN, and we selected diabetes as the focus for that initiative to align with our first integrated health service plan. We're really focusing on individuals with or at risk of diabetes, and the benefit of the project is really looking at how those individuals receive care in their communities. The focus is around the care team and looking at how they work across partners like primary health care, the Community Care Access Center, diabetic education centers, community support programs, including those that support individuals with mental health and addictions. The Southwest LHIN has really served as a sponsor and facilitator for this initiative. So we initiated the approach in bringing the partners together through the Partnerships for Health project, but we've had an expert project team really leading the process and really working with the different providers. We've sat as a sponsor working in partnership with the Southwest CCAC, and the CCAC is the transfer payment agency for the project, and we provided strategic direction and guidance and ensured that the initiative was really aligned to our integrated health service plan. And we're also looking at how we now support and sustain the progress that's being made through Partnerships for Health as we look into the future. Sure, in the context of this initiative, we're working really closely with the Southwest CCAC. And because they really work with all of the providers across our LHIN, they're in the perfect position to be a key partner for this initiative. And then at the table, we also have representatives from the DEC programs, primary care physicians, etc. So we really do try to, I think, support those partnerships. We have a steering committee within our LHIN, a chronic disease prevention and management steering committee that has all of those partners represented. And our Partnerships for Health project team is represented at that table as well. So we continue to play a facilitative role with our partners as we look at developing our chronic disease prevention and management strategies going forward. I think the LHIN was really an enabler in this process. We were presented really with the opportunity to seek outside funding through the Ministry of Finance through their Strengthening Our Partnerships initiative, and we were very fortunate that they worked with us in the Ministry of Health to support this initiative. We really helped put the business case forward to secure the funding, and we've continued to provide guidance and leadership to the project. The whole approach to Partnerships for Health is based on the quality improvement model. And so we really are looking at supporting teams to provide best practice care to their patients. And so we are starting to see improvements of outcomes, clinical outcomes and indicators that we're tracking for each of the teams. But beyond that, it's about developing relationships within the healthcare system. And so you will hear examples, for example, from case managers from the CCAC about having new and different relationships with primary care physicians. And that doesn't just have benefit for individuals with diabetes, it has benefits for all of the patients that those practices see. And so I think that the true outcomes are really around a more integrated and coordinated approach to care, not only for diabetes, but extending to other conditions within our LHIN. I think ultimately our patients will benefit the most from this initiative, but within that as well, the teams themselves are benefiting. They really are going through a great process to learn about their patients, how to use their data and their systems, how to develop their relationships and have clarity of roles with the various partners within the system. And so although patients receive the ultimate benefits in terms of their health outcomes, really the providers are also benefiting in terms of how they work together as a true team within the healthcare system. We're very fortunate through Partnerships for Health to have a formal independent evaluation being conducted. So we're working in partnership with the Thames Valley Family Practice Outreach Unit, and Dr. Stuart Harris, an expert in diabetes, is the lead investigator for the evaluation for that project. So we have a very detailed project plan for the evaluation and reporting on the project. And then beyond that, the team itself, the project leadership team, is also collecting additional information to support a review and evaluation of the initiative going forward. The CCAC is also tracking some data and information that's been very useful. So in the end, we're really coming out with a very comprehensive understanding of the benefits of this project. Certainly, there's always challenges when we're measuring. Oftentimes, we don't necessarily have the data or indicators readily available to us, and so we've had to work with the teams to collect information. And certainly, we all look forward to the electronic patient record and the diabetes registry, which may help us with some of that data collection. But in the interim, processes have been in place to help with that collection of information. It can be very labor intensive for the teams, but they've had support in pulling their information, their data going forward. But that data collection piece can always certainly be a challenge. And as well, I think the other challenge that I'd identify with the evaluation component is really just the time it takes before you start to see movement and outcomes. And so some of the interventions we are implementing will see longer term outcomes and longer term effects that we need to track over time. I think there's been a number of key success factors for this project. One of those for sure is the coaching support that we've been able to provide to the teams. Those coaches are working diligently with the primary care physicians and the other members of the team to help them again with collection of data, reviewing their information, and really just keeping on track with the improvement model and the tests of change that each of the teams have been implementing. So there's really been a lot of hands-on support to the teams, and that's been really important for the success of the initiative. We've also been very fortunate to be able to provide to the teams some support around information management. So a number of our teams do have electronic systems, electronic medical records, but they haven't always been optimizing the use of those. And so we've had some information management support that's been able to go in and work with the teams again to help them to use their systems to their full potential, to actually use the data to help inform decision making related to care. And so those extra resources, those really high touch resources that have gone in to work with the primary care practices have been a key success factor. I think with all of the work that we do in the Southwest LHIN, supporting and facilitating change is really labor intensive. We recognize that healthcare is very fast paced and really a lot of change is always ongoing. So getting people to the table, recognizing the time commitment and supporting that is always a challenge. And so that's been, I think, one of the challenges, just getting people to participate. And we've been very fortunate now to have over 50 primary care practices involved in this project. We've had the ability to have more in the project, and just getting the word out there and getting those folks to the table continues to be a challenge that we're working towards overcoming. You know, I think the one comment I would make from a LHIN perspective is around the recognition that within the LHIN accountability framework, we do not have the primary responsibility for primary health care. Yet we understand that in trying to reach for a truly integrated system of care, we need to have those partnerships with primary care. And so Partnerships for Health has just been an amazing opportunity for the Southwest LHIN to work with its partners, including our primary care physicians, to really look at how we improve care for patients and families within the Southwest LHIN. So we've been very fortunate as a LHIN to be able to embark on that journey with our primary care partners because of this initiative.